This podcast is for entertainment purposes only. The opinions expressed in this episode are not to be construed as medical advice.
Welcome to Demystify Beauty, a weekly podcast about creating transparency in the beauty space. I'm Mackenzie Westmore.
And I'm Dr. Paul Nassif. Hello, Ms. Mackenzie.
Hello, Mr. Nassif. How are you?
Well, I'm doing great, but especially, I got my labs back.
I know, I heard.
And I know that we have some, we have good old Edward and Michael back, and I'm sure they're going to have someone with them to talk about this. But, I'm pretty good with a lot of the anti-aging stuff and also myself. But it's going to be interesting because, remember, this was part 2 with Evolve. So this is going to be pretty interesting.
Yeah, so with that, I would love to introduce our guests. We have Edward, Michael, and Dr. Villanueva from Evolve Anti-Aging. And I am so excited because, Dr. Nassif, as you know, I did this blood test with my intolerances and everything. So I've had my results for a while, and I'm so curious to hear what yours turned out to be. So, gentlemen.
That's right, because, the intolerance about food and all that stuff. Yeah, I want to hear all that.
Yeah.
Absolutely. Good seeing both of you again. Thanks for having us again. And we're welcoming Dr. Villanueva. He's our medical director. So he's the brains behind all this. He gives us all the tutelage and what direction to go in. And really excited to have him on the podcast and to see you guys as well.
Awesome to have you all here.
Hey, tell me, guys, when you talk about, this is good for the audience to know. When you talk about a medical director, can you explain what Dr. Villanueva does?
I actually have known these Edward and Michael for, I imagine, 15 years through different venues. And when the idea of creating this clinic came up, we got together and decided to do it. And my role primarily is help in the selection of programs and services that are delivered along with them to make sure that we do it as close to scientific as possible and we keep it as safe as possible. We want to help the clients in their specific, let's say, hormonal needs, but we have a very intense scrutiny of all the comorbidities that they may bring with them, and we help and sending them out to their physicians. And we have picked up many significant conditions, a patient almost in diabetic coma, significant electrolyte imbalances, a number of things that need additional care. So basically what I do is we organize, talk, get together, as Edward said, once a year, at least face to face, and then we're constantly on the phone. I consult on the phone with maybe 10, 15 patients a day that they want a confirmation of their plan and their idea. So I give the medical end of the equation, let's say.
Hey, what is your training?
I was an obstetrician gynecologist with a postdoctoral fellowship in reproductive endocrinology. That, as you know, is one of the 3 subspecialties of OB/GYN. Yeah, GYN cancer, high risk obstetrics, and reproductive endocrinology and infertility. And I've been around, I look very young, but I've been around many years, and I did advanced reproductive techniques. I continue doing that. I'm in a fertility clinic here in La Jolla, and but many of my patients started getting old with me, and so the third leg of reproductive endocrinology, that post-reproductive years, their needs and their it became a menopause clinic, an andropause clinic, if you can call it like that. And we focus in assisting people with hormone supplementations and whatever they need in their post-reproductive years. And I was in the faculty at the medical school here at UCSD for a few years,
Hmm.
and then I've been in private practice for many years as well. We have in vitro fertilization program and take care of patients with all kinds of fertility needs as well.
Dr. Villanueva is a little modest. He was actually the first physician in California to successfully do an IVF transfer. So he's one of the pioneers when it comes to infertility.
Yep.
Oh, almost. The first pregnancy was, of course, in Great Britain in 1979. The first pregnancy in the United States was in 1981 in Norfolk, Virginia. And we had our first pregnancy here in San Diego in 1981, and it was at that time very, very newsworthy. And
Wow.
that of course the field has advanced significantly.
Especially out here. I have a lot of my medical school colleagues that went into this. They love it. And especially, a lot of them got into the business of the whole, the storage. That's a whole interesting thing, the storage of the eggs,
Yeah.
of the embryos, everything. Another, that when I first started learning about reproductive medicine and also the hormones and all that, there was a doctor locally in Beverly Hills that was doing it who got into this whole anti-aging concept of medicine, Uzi Rice, years ago. And then another friend of mine, Richard Mars. Yeah, Richard was a good friend of mine too, or is, I haven't seen him in a while. But this whole reproductive medicine aspect and especially the hormonal aspect is huge. And I know that you have to really learn a heck of a lot about that because you know a lot about the whole reproductive system and all the hormonal imbalances and stuff. So that's great. How did you guys hook up, with Dr. Villanueva?
So our mother, so the family business is medical practice management and billing, and we had the pleasure of having Dr. Villanueva as one of our clients. And with us being managers of that family business, we developed a relationship with the doctor. Especially, we would take turns going down to La Jolla to service his needs because
Oh
La Jolla,
yeah,
it's a little beautiful down there.
yeah,
So
it is beautiful down there.
Yeah, it
we
is.
we competed to go down there. So and from that we developed a very strong business and personal friendship with Dr. Villanueva, and I believe it was Edward that had the idea to say, "Hey, we're on testosterone. We're getting it from a place that we're not really being treated well, and since we understand the back end of medical, and doctor is so familiar with hormones, reproductive hormones, we Edward pitched it to the doctor, and then usually when you pitch an idea, you're like, okay, maybe I'll hear back, maybe I won't, and it was an immediate, okay, let's do it. So
Like,
Wow.
now the pressure's on us. Okay, now we got to get started. So it was
I open this can of worms now. I gotta make sure I can deliver. So, which is it's been a great journey. So, our background in starting off the clinic, we opened in October 2019. Of course, COVID hit. But luckily, when we applied for licensing, we also applied for laboratory licensing. So when COVID hit, we had a brand new laboratory ready to go. So to shift from from hormonal and then standard blood work to going and doing COVID testing was quite easy shift, and that's how we were very blessed and very lucky to do all that. And then again, once COVID kind of died down, we stepped into what we originally wanted to do, which was the anti-aging, the hormone replacement, and this is why we're really excited about sharing your results, Dr. Nassif, and going over them because there's some really interesting things here that I'd love to get into with you.
But what's interesting? A lot of on these podcasts, I'm going to make this judgment on this podcast, especially talking about beauty. A lot of the, shall we say, a lack of, the males aren't going to be listening to in general this podcast in general. a small percentage more female than male, or whatever gender fluid aspect that we want to, mention that be reading this, but or listening to this. But what's great about today is because I have so many friends that are always asking about hormones, especially testosterone, taking the estrogen blockers, everything. And so this would be the podcast for all my buddies out there that are always asking about getting on some tests. Are they too young and blah, 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 and everything. This is a great one for them to listen to. So just to let everyone recap, you guys sent a wonderful lady over to my house when I was fasting and took my blood. And our goal was to learn, took all types of my blood for all different types of testing. So since you guys are the expert and I'm going to act like I am the patient and you were doing a consult and, I'm on a little bit of, I'm going to say that's okay because I'm 61. I'm on a little bit of test.
Dr. Nassif, I'm too. Women need testosterone too.
There we go. I remember we talked about that last time.
Yeah.
So anyway, so go ahead. I want to have you guys start just like we're sitting here as the patient. What would you do with these results?
Sure. So as you mentioned, we did quite a few different lab testing. We did hormonal testing, baseline testing, things that we do in-house. We also did something where we send out to specialty laboratories for your food sensitivity and inflammation testing as well. But just to touch base, Dr. Villanueva has his clinic down in La Jolla. And it's interesting, down in La Jolla, I believe, and correct me if I'm wrong, Dr. V, your patient mix is around 70% female, 30% male. Whereas here in Encino, the patient mix here is closer to that 70-30 reversed. So we have more males than females. So just to give you a little bit of insight, it's even though most people think, testosterone's for men only, absolutely
it's not.
As you can see, Mackenzie's on it as well.
Yes, you're right. I have a more female, maybe because of my past history of being an obstetrician gynecologist. I've been in years here. But that's indeed the separation between males and females is 70-30 more or less.
So I'm going to share my screen. That way we can go into Dr. Nassif's blood results. Can everybody see this here okay?
Yeah.
Yes.
Okay, great. So we're going to start off, Dr. Nassif, with your methylation detox profile. Okay. So the methylation detox, this is essentially, we're looking at 5 genes that were given from your parents, from both sides of your parents, from your mom and your dad. Anything that's green, that means that specific gene, there's no mutation in that gene. If you see yellow, where you see the MTHFR and the MTRR, there is one of the mutations from one of the parents. And this is where it's like, it's not necessarily 100% you're going to be having these issues, but you could be predisposed for these certain issues that are going to be coming up. And then we have something where if it's red in color, then it's from both parents that gave this gene that can potentially, you have more of a risk of having these different issues that are coming up. And what are the issues? Some of them are the methylation of DNA, neurotransmitter, xenobotics, and other things of this nature. So start off with the MTHFR. So your MTHFR, it really affects your homocysteine levels, okay? Both with MTHFR and MTRR. So if you come down to this section right here, it'll give you more detailed information of how you can protect yourself and how you can protect yourself from having these homocysteine issues. And we all know that homocysteine has to do with cardiovascular health, with your cardiovascular system as well. If you take a look at your homocysteine panel, we have it here. You came back at 11.6. Now, it's still considered in a normal range, but it definitely is on the higher end of that normal range. We love to see this around the 7 to 8 rating as far as the ranges goes. So taking a look at what are the things that you can implement as far as foods and different types of vitamins to help you with these homocysteine levels. We're taking a look right here is B12. B12 is a really good way to make sure that you're protected with your MTRR. Cofactors, riboflavin, niacin, magnesium, zinc. These are all vitamins and nutrients that will help you with your MTHFR and MTRR. If we go into the next slide, which is your cellular micronutrient assay, this is actually taking a look at your specific vitamin profile and how well your body is absorbing these vitamins. And as you can see, whatever you're doing, Dr. Nassif, you're doing great, because we're looking at your B12, we're looking at your B2, B3, B6, all the ones that I mentioned earlier in regarding to your homocysteine levels. You're doing everything correct. So continue what you're doing. Okay.
Now, Dr. Nassif, by the way, we both do not make biotin.
Well, I got biotin gummies now. I'm sure you guys have some. That's one of my new products. Biotin.
But I just think it's ironic. The one thing we don't make. Are we related somehow?
We must be.
We must be.
Okay. So coming back to the vitamin profile. So as you can see, we have some of these vitamins and nutrients and amino acids that are needed within your system, within your bloodstream. And the severity of this, it really depends on how much you need it. For instance, your biotin is 140% insufficient. And the way we find this information out is not to get too technical and too scientific, but we take your whole blood, and we take out the lymphocytes and we introduce biotin to these lymphocytes, and we measure the reaction. Regarding what that reaction shows, it tells us how much of an insufficiency you have. And what's great about these reports, and this comes with everybody's blood work that we do in house, is it'll give you an update of what are these micronutrients, what are they for, and what do they help with. One thing that brought up to my attention that is very interesting for me, and to take a look at your levels, Dr. Nassif, is your biotin. Okay, so it helps the proteins turning fat into energy, which everybody knows this. Health of skin and nails, everything is really good. But this thing right here, it says diabetes. Diabetes. When I saw this, I said, wait a minute. This is the reason why we do a lot of blood tests in house. We took a look at your hemoglobin A1C, and you are at the very, 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 very beginning of prediabetes. So
I've had a high hemoglobin A1C, and I've been on metformin now for about 5-6 years. So that has always been pretty high for me.
Okay, so this might be a really good option to maybe increase your biotin intake. You did say you're supplementing with biotin. Potentially, you could be supplementing with more to.
Yeah, I'm not yet. Have not, but I have the gummies. We just released them.
Mm-hmm.
But I'm going to start taking more biotin there after this discussion.
Okay, that's great. That's really good. Overall, your vitamin profile, it looks very, very good. I'm very happy with what I'm seeing. So I think there's a few tweaks that need to be made here and there, and you can really improve and elevate your overall health.
May I make a quick comment?
Yes.
Yeah.
With the hemoglobin A1C in the borderline as it is, and having been on metformin for a few years, it would be an opportunity for Paul to consider semaglutide. One of the main effects of semaglutide will be to lower the hemoglobin A1C. So I'm just throwing it in there.
Yeah, well, I'll tell you one thing, though. I tried that originally, before everyone was going crazy trying to lose weight with it. Tried it 6 years ago, and I forgot which one I tried, but I was never so nauseated in my entire life. So I don't know if there's one that's not, as nauseating, but I remember I was operating, and I actually threw up immediately. I was throwing up left and right.
Oh my God.
Yeah.
It could be a matter of dosage, and also I believe that we have two GLP products, don't we, guys? Don't we have semaglutide?
Yes. In terms of peptides, we have the tirzepatide, which is the compounded generic Dara.
It has an incredibly safe profile, and we are very, very, very impressed with the success that we get with it. And actually, I would have no reservations. You might lose some weight, which you probably don't want to, but
yeah, and I can always do that.
Yeah, like Gloria Vanderbilt said, you can never be too thin.
Or too rich. Yes.
Well, it's something to think about. And you talk with the experts. Those two guys there, they have accumulated experience of semaglutides of many hundreds of patients. I hear the ones that are interesting or different, but they see patients for semaglutide day in and day out. And what is your feeling in regards to side effects, Edward and Michael? There's nausea, vomiting. How common is it?
So we've been able to implement something that we call the Bible, the weight loss Bible, or the Ozempic or semaglutide Bible, which essentially lists the foods that can cause the nausea. One of the aspects of this weight loss medication or GLP-1 agonist is that it slows down the waste process of digestion, meaning the food is going to be slowing down in the small intestine. Now, foods that are difficult to digest, such as dairy, red meat, fatty foods, heavily. Uh,
I mean, I have to tell you though, for me it was the product itself that I thought I was on low dose that was getting me really sick. And is there a difference between the two then that might work for me better
Well,
than?
I was just going to ask a question. Correct me if I'm wrong, but don't you guys, it's more of a compound instead of just the Wegovy or the Ozempic. Isn't that more what Evolve offers?
we do offer both. We can give prescriptions for Ozempic or Mounjaro. We also have access to the compounded versions as well. 6 years ago,
Yeah.
semaglutide wasn't really on the radar as it is now, and it hasn't been
Right.
perfected or perfected. I know I know 6 to 10 years ago they were using more tesofensine, tesamorelin, things like that that do curb appetite, and those tesamorelin especially has a lot of side effects such as nausea, vomiting, and
Oh.
it's on the higher scale compared to how semaglutide and tirzepatide operate now. I feel like it's much more refined nowadays, especially with the data of knowing what to eat and what not to eat, how it affects the pancreas, how it affects your metabolism, and all those things. And with all the experience that we have with our patients, we've been able to kind of deduce what's causing the nausea for the vast majority of our patients, and it's typically what they're consuming.
Mm.
Really? That's interesting. That's interesting.
Okay, so coming back to Dr. Nasta's serum micronutrient assay, like I said, there isn't too much that we can. There were some things that we can definitely add and help with, but overall, this looks very, very good. So what we would do at this point is, we would consult with the patient, and at that time, we would come to a plan and create a bespoke vitamin based off of the labs that we have thus far. And there was one more thing that I want to discuss with you as well. This is your food sensitivity test. Now, a lot of people might say, oh, this is a food allergy test. It is not an allergy test. This is a sensitivity. So these foods are causing inflammation within Dr. Nassif's bloodstream. And we all know that the core of pretty much every disease out there is inflammation. So we have 4 sections here, starting from severe, going to moderate, mild, and unacceptable no reaction. So the severe section, it's recommended that you avoid these foods, which is trout and monk fruit, for at least 6 to 9 months. And just keep in mind, Dr. Nassif, I don't know if you are doing any type of keto or ketogenesis type of diets. Monk fruit is a very commonly known sugar replacement. So they're not using like high fructose corn syrup, or they're not using grain sugar. Monk fruit is being used to sweeten certain
Yes, I
dietary
heard that.
bakes and
Wow.
whatnot. Yeah, so keep in mind with that. It's causing severe inflammation for you. And typically we see anywhere from, 1 to 2, all the way up to 5 or 6 items in the severe. The majority of it is either going to be the moderate or the mild. So in the moderate section here, again, I've seen way worse. Mine's is a lot worse than this. But there are certain things that you should definitely avoid for at least 3 to 6 months. Like agave, almonds, apricot, arrowroot, any of these foods that you see in the moderate list, are you consistently, or have you been having it for on a consistent basis?
Well, I'm looking here. I'm looking down on this one. iceberg lettuce.
Mm-hmm.
I just came back from back east and I had a lot of lobster.
Mm-hmm.
I'm writing these things down too. Um, Now, is that turkey?
That is
Yeah,
turkey.
turkey.
Oh, Jesus.
Yeah.
So I eat a good amount of turkey.
Okay.
See, that was
So
me, and I had
turkey.
the same thing, and I had to back off. I stopped eating as much turkey.
So
Okay.
this is a great question I can ask. Mackenzie, how do
Yeah.
you feel? How long you been doing your diet now? Your food sensitivity diet. How long have you been
So it's
taking it?
been a couple months now. And
Mm-hmm.
obviously there are days where, I'm not fully on top of it, but here's what I noticed. Today is a great example. Last night I had QVC, did not have time to get dinner going, so ended up having a meal of a bunch of bread and brie because that's what we had in the house. I woke up today so sick to my stomach because I know on my list there is a dairy intolerance. So, with my intolerance, I'm looking at it right now. I know that milks, casein, whey, gluten, those were some of the things for me that, well, not gluten, but so those were the dairies were some of my intolerances, like high intolerance. And I woke up today thinking, oh my God, am I sick? I've got this horrible stomach ache. And before we started the podcast, I took a bunch of Tums and touch wood, I'm okay now. But this is a great example where it clicked in my head. Well, duh, I'm getting on with Evolve. And here we're talking about Dr. Nassif's intolerances. This has got to be what's doing it because now I'm feeling much better. So I do find that when I eat the things that are on my no-no list, is what I call it, I don't have a great day. And when I stick to this list, I feel on top of the world. I sleep great. I don't have stomach aches. I can work out. I feel fine.
And imagine all the Americans that, and all the people in the world that aren't aware of this kind of testing, that they have this inflammatory response, and
Yeah.
they just think that's the way it is, and they've accepted it, and they don't know that this kind of technology and testing exists where we can reduce the inflammation, and they're going to feel kind of weird feeling better because a lot of people are struggling with inflammation.
Was milk on my list? Where does milk?
Yeah. Let's take a
It's
look.
still on
I'm
the
going to bring it
bottom.
up again. So if we take a look at the bottom of the list, we're going to see that
Yeah, see,
you
that's
have no
mine.
reaction to casein or whey. So everything here looks good, but you do have a decent reaction to gluten, Dr. Nassif. How do you generally feel after you have gluten? Are you trying to have a gluten-free diet?
Yeah, I mean, I'm just average after gluten, so I
Okay.
noticed that, and also um, I have some sensitivities to also lactose. Is that what
Mm-hmm.
that is?
So it's not a lactose insensitivity test. It's more of if it's causing any inflammation. So as of we take your leukocytes and we introduce casein, whey, and lactose into the mix here. Casein and whey are in the green. You're okay. Lactose, you do have a little bit of inflammation, but it's nothing severe like how the barley is on your gluten side, like the barley malt spelt wheat. It's a little bit more sensitive. So it's not that, like I said, it's not necessarily a lactose sensitivity test, but it's more of an intolerance test, right?
Got it.
Yeah, and then if we come back up to the top of the list, we take a look at the mild list. Now, the mild list, there is some inflammation, but it's not significant enough where to take it over to the moderate and severe, and it's still a little bit more than acceptable reaction. So for this, they suggest, what we also suggest is a 4-day rotation on these diets. So, like for instance, apples, artichokes, avocado, bananas, beef. Have this on a 4-day rotation, and it'll give you, if you can avoid eating it, even better. But it's a big list, so
Yeah.
um, it's going to be tough to avoid, avoiding all these foods. And then if we come into the next page, it'll give us the tests explain the color and the coding for it. And then the page after this, it'll give us a 4-day rotational diet. So day one, it'll give you, what grains and starches, vegetables, fruits, proteins that you can have. And then it'll give you a 4-day rotation. As you can see here, beef with the asterisks on it and bison with the asterisks on it. It's on a certain rotation where you should be having it once every 4 days. You won't see it again until the fourth day again for these proteins. Okay.
Got it.
Yeah, and then this is again some more information about the different foods and what you can expect from them. And coming down, what we also do is something called a chemical and mold test, where it'll give you more detailed information. For instance, I don't know if you take a lot of pain relievers, but if you take a look here, this is Tylenol, aspirin, ibuprofen. These are all pain relievers, and a lot of people will take this for inflammation. They'll say, "Oh, I need to take a aspirin because I'm inflamed. I have my joints hurt." Well, it's very possible that you take this, aspirin, ibuprofen, acetaminophen for your joint pain, and it'll cause more joint pain.
Wow.
So this is very, very interesting to have all of these. You typically see one or two in the moderate or in the severe. You have all of them in the severe. So or the moderate.
Yeah, I do take baby aspirin.
Okay.
1 milligrams, cardiac wise.
Yeah.
And I'll take a little acetaminophen once in a while, but thank God about that. But I do take the baby aspirin.
Yeah, this is good information. So if you ever take it or maybe overdo it, take a little bit more than you're supposed to, you might have that reaction of I'm feeling more inflamed, I'm feeling joint pain, I'm feeling different items that you're feeling. And these are the functional foods and medicinal herbs tests as well. So a lot of people will say, "Oh, I'm going to take my antioxidants because it makes me feel better." Well, these antioxidants could be working against you. So we've been hearing a lot of good things about mushrooms lately. This specific mushroom, Maitake mushroom, is actually a moderate inflammatory for you. So you got to be careful with that. Even with like elderberry saying, "Oh, elderberry is great." It is, absolutely. But for you definitely have to do it on a 4-day rotation. You can't take it every day or every other day even. And the idea, ashwagandha is another very, very popular one.
Mm-hmm.
And the idea is this: when you have things that are in the severe and moderate and the mild, when you avoid eating these foods, essentially what you're doing is you're allowing your gut biome to heal. It's like a scab. The more you pick at it, the less it's going to heal and the longer it's going to take to heal. So by removing these foods, it's not a forever thing. It's more of a let's let the inflammation go down before you start reintroducing these foods. Okay?
So I think I want to have you guys do my wife too.
Okay.
She needs this. She has some abdominal issues, but so that's the food.
Yep.
And the vitamins, and actually, that's something I kind of really got to. I haven't really paid that much attention to the food until I got on with you guys.
Yeah.
You'll find you will start paying attention because that's what happened to me. I was like, come on, it can't be that big a deal. And then when I started following, I was like, oh crap, this thing is real. This really does work. But I mean, I'm sorry guys, I gotta be honest. When I first took it, I was like, come on. But it's very true.
There's nobody more skeptical than myself. I'm a big skeptic as well because
you and I are like,
you see a lot of snake oil salesmen. You see it everywhere. But the way that myself, Michael, and Dr. V, we vet these things is we try it on ourselves first. Mm-hmm. So I'm sure you've heard this in the clinic, Mackenzie. We have something new coming on. We're doing the testing. Mm-hmm. We're the test guinea pigs.
And I love that.
Yeah.
Well, I think what really clicked for me was it was you, Michael, where you were constantly getting sick after IV drips.
Yeah.
And I was like, what's going on with this? Because I was new to the clinic. And I was like, what's going on with this clinic? My business manager sent me here and this guy's getting sick all the time. He's getting IVs. But you did this test and you found an intolerance to ascorbic acid.
Yes.
What is that? That's vitamin C. And go ahead, tell your story because I found that fascinating.
Yeah. So one of my responsibilities, I have face-to-face with our clients every day. I'm seeing 10, 20, 25 people a day. And there's constant exchange of bacteria. And the first of the month, I think I mentioned in the last podcast, I get sick.
Yeah.
I'm getting sick. I'm feeling tired. I do a drip. And the next day, I can't get out of bed. I'm floored. And I'm constantly trying to figure out what's going on. I'm on testosterone. I'm on our growth hormone secretagogues. I'm on everything we have. I'm getting sick. So we did this test, and we did my CMA, which is the inventory of my cell, my vitamin C as well. It's 140% insufficient. We did my what is it called, the ALCAT. We did the ALCAT. My ascorbic acid isn't severe. And in
It's crazy.
one of my other tests, my inflammation, my protective assay, my vitamin C is through the roof. It's one of the most protective assays I have. So what that means is every time I was doing a vitamin C drip when I was tired or feeling sluggish, it would create more inflammation in my body. And what attacks inflammation? What does how does your body respond to destroy inflammation? It uses white blood cells.
Right.
And what creates white blood cells? Vitamin C. So
Yep.
I was doing more damage than good
Then
in
good.
doing the drips and thinking I was doing something right. And just to kind of segue into my favorite part about this testing, we get young men in this clinic, early 20s, and they come in with really low testosterone. We run it back to the doctor after our lab gives the results. 175. Young man is 22 years old. Doctor says we need to check for a pituitary tumor. We check it, everything comes out well. We ask about the diet, and the diet, it's not the best diet. It's the common 20-year-old diet, which is hot Cheetos, Mountain Dew, and Call of Duty. We do this ALCAT test on them, and we see all of the things that they're consuming or that's causing them inflammation, and they confirm that they're consuming. We get them off of that food. We wait about 6 months. They're completely clean from that food. We retest them, and their body's able to synthesize their hormones again. So their testosterone levels come back up. Their luteinizing hormone, which is a signal from the pituitary to make the testosterone, is back up again. We could have had a client for life. Sounds good
Yeah.
to us. No, we want to fix the issue because it's we know something is it's a deeper problem than just having a low amount of testosterone. There's something causing disruption, and it's
Wow.
usually inflammation.
You know, the technology is cutting edge. I mean, this has
Hmm.
been around probably for 10 years at the most, or a little bit more, not a whole lot more than that. And I've looked at with some degree of detail, not as much as because it's hard, it's very advanced chemistry, but it's brilliant.
Hmm.
And the way that they do this is quite credible. They take the blood like they took from Paul, and then they separate the white blood cells, and then they expose these white blood cells to 500 agents between foods and toxins
Amazing.
and yeah, uh, any other thing that it's in that list. Then they have a way of observing both visually with a microscope and also with sophisticated measurements like such as impedance, the electricity running through these cells. And there's changes in size. The white blood cells get bigger, get smaller. Eventually, they puff up and they break. And when they break, they let out these cellular debris, the mitochondrial debris, cytokines, interleukins. These are, as we know, these are inflammation-causing agents,
Hmm.
and they bring a little bit of light into the future for all these illnesses and conditions that we have not had a good grasp on.
Hmm.
Irritable bowel syndrome, Crohn's disease, eczema, but inflammation, as one of I think Edward said very appropriately, it's at the root of most of these chronic conditions that we deal: obesity, diabetes, hypertension, heart disease. And so I was very impressed with this. And actually, then we have the anecdotal experience of people that say, like Mackenzie said, I did this, or I think it is worth the effort and it's worth the attention that we're paying to it.
I
Well,
agree.
just to add on my 2 cents to this, because I know we're getting down to the wire in regards to time, is that number one, um, it makes 100% total sense to me, especially with the inflammation, but then also, even cortisol levels start to increase.
Hmm.
I just got back from a vacation, and of course, I overdid it on everything. But I tell you, it was fun. And thank God wine's not on that, but of course, that's its own inflammatory aspect. But I want to go through this deeply. I want to look at the diet. You also you got me the other stuff too, the other labs. And I
Mm-hmm.
want to talk to you guys on flight about that. I want to talk to you about my wife, Brittany.
I've been there at the clinic since 2020, And I've seen the changes you've all gone through, and you've seen the changes you've helped me go through. And all the way from COVID to now hormones, and balancing out my hormones, and especially after my surgery, and all that you've done for me. So I'm forever grateful for finding you and being part of the clinic. And I feel you guys are family now.
I feel the same.
In fact, I changed my patch last night. I keep on top of that. I have my list of when to change my patch.
And how's treatment coming along, Mackenzie? Are you feeling the effects? Are you feeling like the energy and the overall wellness of the testosterone and the estrogen?
I am, and the progesterone. I mean, I think with everything that we're doing together, I think that's probably what's attributing to me sleeping almost 9 hours a night, and good sleep, not just tossing turning, like good solid sleep, and waking up like, wow, let's get the day going. I didn't have that years ago. I feel better now at 46 than I did at 40.
It's so funny. I was actually telling somebody not too long ago, I'm 43 and I feel more energetic. I feel better than I was in my 20s.
Yeah.
I was in my 20s.
Oh, hell yeah.
It's life-changing for me, at least.
And the same for me. My 40s, I feel way better than I did in my 20s. I have more energy, more pep in my step, more spunk. So
the hormones affected our lives so much that I changed my career completely to open up this clinic with my brother and Dr. V, because that's how much of an effect it had on our lives, both of our lives.
Dr. Nassif, you and I haven't talked about this, but I did, because I didn't want to go into the whole dealing with anything that women can deal with. So I do have the progesterone, I have the estradiol patch, and I do shoot my testosterone every 2 weeks. And balancing out my hormones like that, we were just talking about it. I feel better than I did in my 20s. I mean, now that I'm balanced, I feel I'm not biting everybody's head off. I'm happy. I'm sleeping solid, and not just like tossing, turning, like a solid 8 to 9 hours a night.
I can say that, of all the done in all my years, in vitro fertilization was a great step forward, but adequate, good, safe hormone supplementation for men and women at this age or in the 40s and up is the most satisfying thing that I've done in a long time. At times I put it next to vaccines, penicillin. You do surgeries, and when we do surgery, instant success. But you don't see that in medicine, in clinical medicine. You need to, and you're treating cirrhosis or depression, and that's a lifelong, step by step. A woman or a man comes into the office with a horrible history and unhappy and weak and anxious and no sex drive, and in a week we can tell them you're going to start feeling the benefits, and in no time it's a different person. I hear this all the time.
Yeah.
Well, with that, let's hear what you guys have to say.
All right, so let me share my handy dandy screen once again. So, Dr. Nassif, to get a little personal, you did mention that you're on testosterone, which is great. It's phenomenal. Now, my question to you is, what is your dose? Excuse me. What is your dose? What's the delivery mechanism, and how often are you dosing?
Maybe 25 milligrams on Monday, Wednesday, and Friday.
Okay.
Sub-Q.
Okay.
My hip.
Yep.
Because when I get on a little bit, when I start getting a little agitated, and the temper goes up a little bit, and that's what I'm doing right now.
Okay.
And I don't know, I can't see there, but is there free testosterone there too? Did you guys measure that only?
Free testosterone is send out. It's not something we do in house. For us, the more important is the total testosterone, the testosterone being used. Because as you know, this free testosterone doesn't really do much; it's just floated around in the bloodstream.
Yeah.
But for the total testosterone, you're at 501.57. So if you're microdosing, which you are, which I personally prefer microdosing as well, this is what your average is going to be, around that 500 nanograms per deciliter. Now, going towards the AMA guidelines, Dr. Villanueva, please correct me if I'm wrong. This is still in the normal range. It's perfectly normal. It's totally fine. You're not too high. You're not too low. It's right in the middle. There is a fellow by the name of Dr. Abraham Morgenthaler that I follow, and he's done extensive research regarding what that low number should be. He's a Harvard Medical professor, and he thinks the low number for testosterone should be 450 to 500, meaning that that males show symptoms of low testosterone in the 4 to 500 range. So, with that information, I personally, if you were under our guidance of care and you came and said, "Hey, you know what? I'm at, I feel fine. Everything is okay. Is there room for improvement?" Absolutely. You could definitely go up to 800, 900 to 1,000 nanograms per milliliter, deciliter, excuse me. And that's where, personally, that's where I'm at. I'm averaging around 950 to 1,000 at this current time.
Wow.
Dr. V, any of your insight?
No, that's excellent. Actually, we hadn't talked about Abraham Morgenthaler. He's one of the pioneers in the testosterone studies. I believe that we see the best with 6 to 800 probably is a reasonable average. If you inject once a week or every 2 weeks, you may have one measurement of 500, but 1 week after the shot, and right after the shot, it goes up to 1,000.
Mm.
Those peaks and valleys are good, and that's where you feel your best.
Just because of our timing here, let me ask one more quick question. Thank you for that information. But when do we, for men, but when do we start talking about the increase of cardiovascular disease for men on testosterone?
Mm.
That is a very, very controversial and often abused statement. I think that there was one study coming out of VA with a very small number of very old guys, very sick with all kinds of illnesses, comorbidities, and it is not reliable. It's not well done. The dosage is not known. How it what comorbidities they had. They were not being treated with testosterone. They just use them for the study, and that's the only area that cardiologists will always focus on, and they'll say no, there is a risk of cardiovascular disease. There is no as a group, as a population group, men receiving testosterone have lower morbidities and lower mortality than the men not receiving it.
Wow.
Yeah, and they another myth, and you that mentioned Abraham Morgenthaler, and I often look into his work because he is a very prolific writer, as Edward says, out of Boston, and he's written about everything. Prostate is another concern. Oh my God, you're going to give prostate cancer. No, it's exactly the opposite. Men with low testosterone as a group tend to have higher incidence of prostate cancer. And there is
Wow.
no demonstrable negative effect of testosterone in the prostate. There is no demonstrable effect on the cardiovascular system. I just, in order to protect the potential liability, I say to the guys, if somebody is very old, if it's more than 75 or 80, and has a number of cardiovascular risks, history, cholesterol, hypertension, diabetes, obesity, cigarette smoking, well, maybe it's not an ideal candidate to give them testosterone
Mm.
because there is a possibility that something bad is going to happen, and then you have to deal with the liability.
Mm.
But the literature is actually more on the side of protective and beneficial than negative and dangerous. You mentioned, Paul, the changing character and behavior. Am I going to be road raging? I'm going to be angry at people. Well, as I said, one of my the purpose of my being in this clinic is I look into the scientific end of this, and there is a very, very excellent article, very well designed, with enormous statistical heaviness that took low, medium, and high level dosages of testosterone in men and women and compare them with placebos, prospective, double blind. And here's where the crux comes. Uh, well, I think that I feel a little bit more angry. No, 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 no. Sit down every month with a psychologist and do a psychometric testing so you can get a quantitative answer. Is he or she more angry or more nervous or whatever than the guy on the placebo? And the answer is no. There is no significant difference in character change, behavior, and emotions in men or women receiving. So I, as you can see, you go to a tailor and you get a suit. You come to me and I'll give you all the virtues of testosterone supplementation and estrogen for that matter.
So yeah, so just to wrap this up, one thing that I really want to point out is I know anybody that might be watching or listening, they might be thinking, well, this is just a blood test for the stars, or this is a blood test that is unattainable for people. But you guys do this for everybody, all walks of life, across the country. This is something where if somebody's in New York even, they can access this with you. They don't have to be in Los Angeles to do this. So I just want to point that out, that this is testing that is available to everyone. Just call Evolve Anti-Aging and you'll be able to get in touch with this amazing cutting edge blood work. And, you know, you guys, if you would just want to tell everybody where they can reach you.
It's Evolve Anti-Aging and Wellness.com. I believe that's our website. Oh, let me double check that. Evolve Anti-Aging. There we go. EvolveAntiAging.com. You can find us on Instagram, Facebook, and if you're in Los Angeles, we'd love to have you come by. We have relationships with laboratories around the nation. So if you're in New York, you can stop by one of the laboratories, get your blood drawn. Dr. Villanueva will analyze it. We'll all have a conversation with you. We'll get everything started.
I love it. Thank you guys. Thank you guys so much. You're just such a wealth of knowledge.
Yeah, I mean, this was great. And I want to thank you guys, like I said, to the point where I need offline to finish this up. Because, you know, I got to pick your brains a lot more. And I want to thank you guys for that. And again, evolveantiaging.com. And again, hormones, vitamins, minerals, all that.
Everything.
From you guys. Mackenzie, if they want to find you, where again is the
M. Westmore, and I just joined Threads, so you can find me there too now.
Well, I don't even know what that even is.
I'll fill you in.
And mine's Dr. Paul Nassif. Everyone, thank you again, and we'll see you all next week.
See you next week.
Thank you for listening to Demystify Beauty, produced by Gotham Production Studios. Please don't hesitate to reach out to us on Instagram at DemystifyBeauty or email us at demystifybeauty@gmail.com. Don't forget to subscribe, rate, and review the show. See you next time.